So we're going to go ahead and get started so that we can end at a reasonable time for us to start our council meeting. And so I'll just say thank you all for coming for this update on the CARES program. As you may have seen, we had a press conference earlier today announcing the expansion to a second vehicle at a second site, which is very exciting. You're going to hear way more information, I hope, than that in the presentation. So I'm just going to turn it over to Assistant Chief Stedman to give us the update.
Thank you, Mayor. So the updates are a lot of data, and then I'm going to be happy to answer questions. But just for reference, the data is from September 1st of last year when we started through the end of June of this year. So we have been on a total of 678 calls as of yesterday, but this data goes through about 610 calls. So the first slide is just kind of calls per district. We can go to the next one. Yep, sorry. It's hard with a PDF, isn't it? There we go. So calls per district, when we started the first 3 months, we were only responding in the central district, and naturally we were told from the police department that we would probably see more calls in the central district anyway, but after the first 3 months, we started responding citywide, so I imagine that this trend will end up evening out a little bit more over time, but the central district will likely be our busiest district moving forward as well. Next slide. And it's up to you all if you want to ask questions as we go through this, or you can ask at the end. I'm fine either way, of course. So yeah, go ahead and go to the next one. One too far. It's okay. So the previous call, or the folks that have seen previous services, this kind of speaks to how important it is for us to be working with Journey Mental Health. With 63% of the folks that we've been able to sit down and talk with and assess, 63% have actually had a touch with Journey Mental Health. Now, their records go back decades, so we know that some of these touches might have been a long time ago, but in order for us to really manage a person's behavioral health crisis appropriately, it's really nice to see a care plan history to give us a path forward that's most appropriate for the patient. So 33% of the patients we've seen have been repeat callers for us. So we tend to see some of the same people over again, and that's the nature with EMS services as well, of course. And 15%.
Sorry to interrupt. If the chair could hit unmute.
You want my mic on? Oh, no, we want the unmute.
On the,
there we go.
Yep, there we go.
Oh. Are you, okay. Did you hear everything I was saying okay? All right.
No, we did not.
They all did, but they did.
Apologies, gotcha. And then so 15% of the folks that we've seen, we've noted are experiencing some sort of homelessness. Go to the next slide. Just general age breakdown. You can see there's nothing really remarkable here. We do see adolescents and teenagers when called for, but it's not a very common call for us. So the age breakdown is kind of a trend that we would expect to see. Next slide. Race and ethnicity, we do our best to capture this data. You can see that about 11% of the folks choose not to report, or we can't get that information from them, but this is about what we would expect to see. It's in the neighborhood of the makeup of the population of Madison, but certainly important for us to be gathering this information, and we also gather it by district as well. Next slide. And then this is kind of the important one that shows the trend of call volume since we started September 1st of last year. So we started in that central district, like I mentioned, and then once we opened up citywide, we started experiencing higher call volume, and we also were able to put our second CARES team into service a couple of days a week whenever we had enough staffing, so that helped us with some extra call volume as well. I know we just had a press conference today that said we're launching the second CARES team, but that's the full-time second team. So we, like I said, we have been able to put the other team in service occasionally, which has helped out quite a bit. And it's also helped that we've been meeting with the 911 center every 2 weeks to go over the call types that we're responding to, so that they can make sure that they're still giving us the calls that the CARES team should be going on, as opposed to law enforcement. But I can tell you that we all were a little bit cautious in the very beginning of the program, and we probably didn't respond to every call that we could have because we were learning, and we're still learning to this day, but the the good thing is that the trend is going up, and the success for me is that we've been on 678 calls for service instead of or in lieu of law enforcement. Next slide. And so this talks a little bit about CARES 2 and how they're able to assist us with call volume. So in April of this year, we were able to put CARES 2 in service just like 1 day a week, and then slowly we were able to get them in service a little bit more. This was due to the Journey crisis workers. We only had the 2 initially, and then through the process of hiring 2 more, we've been able to slowly get this other team in service. So, the bar on top is CARES 2. So when they've been in service, about 70% of the time this last month they've been in service, they've been able to take quite a few of the calls for service as general. Sorry, you can go to the next slide. I just lost my computer, but I can go off of this. So the second CARES location is on Fish Hatchery. It's 2120 Fish Hatchery, the old Town of Madison building that had the police department, fire department, and clerk's office. And so that's where CARES 2 will be responding out of full time now. When CARES 2 was in service over the past few months, they were both running out of Fire Station 3. Next slide. Should be one more. Yep. Oh, no. There should be just a last slide that shows a bar graph of the outcomes. Okay, I can just speak to it. So the last slide basically showed the outcomes. 42% of the people that we've seen have been engaged in services, in some sort of community service, mental health service, and 18% have been engaged with an acute emergency medical health service, so like CARES crisis unit, hospitals, and other more acute services. So that's about 58% of the folks that we've seen have been engaged or connected with very important services. That the other 42% have been basically folks that we were able to make an intervention with on scene, provide on-scene services through the Journey mental health crisis worker, and they didn't need any further follow-up, or they were folks that simply refused services. That happens occasionally as well. About 20% of the calls we go on responses for are check welfare, check person type calls. When we get there, they actually didn't need us or there was nobody there. And then there's also a subset of people that actually did end up needing a law enforcement response. And so far, law enforcement has had to transport 2% of the clients that CARES has gone to see first. So to us, that is a good number, right? Of that 678 folks that we've seen, 2% of them have ended up being transported by law enforcement for either an emergency detention or some other law enforcement issue. And then some folks need to be referred to medical services, to EMS, for a transport via ambulance. So the majority, the 58% that we're actually referring and connecting to services are the important ones for us. Questions? And sorry, I lost this. Oh, there it is.
There it is.
Nice work, Mayor.
I don't know. I didn't do anything. It's all the clerk.
40% and 18% is 58%, and then the bottom is 42%. So yeah, that connection or reconnection to stable services is 40, connection to acute emergency services at 18, and other outcomes, like I said, is kind of that general group that didn't need a direct connection with services at the time. Now I can answer questions.
Thank you. We'll take questions now. Alder Curry.
Thank you. 2 questions. I guess I'm not a mental health practitioner, but when you said that the data about ages wasn't shocking, I guess to me it was, because it seemed like the highest percentage was those 65 and older. And I'm wondering if there's the presumption, I would say, is if you're further along in life, maybe there are better ways to access resources than being younger and not knowing. And are there any trends that you all are seeing? And then the second part was for the last slide about the connection, like what's considered a connection? I referred and I made touch, or I referred and we know that person was accepted for services?
Yeah, that's the I know. So let me go to the first one, the first question about ages. So 65 and older is a larger age group than the rest of the groups that we grouped out there. And also you find folks with, early onset dementia and a number of other things that the elderly population sees. And they tend to be the ones that might call 911 a little bit more. If they are home alone in need of whatever type of service it is, they tend to be the ones that are more comfortable calling more as well. Like you said, you're not a mental health practitioner, nor am I, so I couldn't get too much deeper into it. But that'd be a great question for Journey Mental Health, might be able to answer it better. And then with the connections, so the question is about the services that we connected people to. It's not just like, hey, here's a number we want you to call. That's not a connection to service at all. So the data that we showed was actually after we follow up with people on follow-up phone calls and downstream, making sure that they're staying connected. That's what we consider connection to services. And that's why there's that 42% or whatever that didn't have connections, because we can do our best to try to connect folks, and they're not always agreeable or they need other services. But yes, that is a true connection where it was either a warm handoff, like we drove them somewhere and talked with a counselor at the hospital or whatever else. But yeah, those are true connections.
Thank you. Alder Heck?
Thank you, Mayor, and thanks, Chief Stebbin, for speaking to us about this and for all your work. Two questions. Can you just speak generally to the relationship and ongoing, perhaps, dialogue, training between CARES and dispatch? Because I assume there are kinks to work out. How do you get better referrals? How do they, how that's progressing? And then the second question is, can you address staff retention for both fire department and Journey Mental Health? Because I'm wondering about that a lot of training goes into this, and I'm hoping folks are sticking around.
I worry a lot about retention, and I worry a lot about longevity. But to answer your first question, we meet every 2 weeks with the 911 center. So the director is Louis Bixler, and then we also meet with his operations director and a manager. So the questions in those meetings are exactly what you're talking about. It's about call types. It's about miscommunications between law enforcement, fire department, EMS, and CARES. And it's about the call types that we think we should be going on, but the dispatchers maybe aren't sending us on because of some safety questions. And just as an example, early on, if a homeless person, for example, said that they had a pocket knife in their pocket, right? They ask safety questions. Do you have a knife on you? A homeless person says, well, yes, I have a pocket knife on me. They might not have sent CARES. Once we found out that was happening, we're like, listen, we understand that homeless folks probably have a knife on them. It's about their intent and their behavior at the time. And our crisis workers from Journey and our paramedics were comfortable going on those sort of calls. So it's all about keeping the dialogue going, but we do have a standing meeting every 2 weeks on Tuesdays at 11 a.m. with the 911 center to help correct some of this stuff. And it's also with the police department as well. There's a police department representative in that meeting. Our core team of providers is in that meeting. So, it's not just the chief and the director having conversations about it. Our CARES medics and Journey crisis workers are involved as well. And then I talk so much, retention, yes. So I can tell you that luckily in the fire department, we don't have a big retention issue. Our paramedics seem to have good job satisfaction, they're well paid, and I'm not too concerned about retention on that end. The Journey crisis workers, we already had one of our first crisis workers that got hired, took a job as a social worker at St. Mary's Hospital. They're master's level with experience. Folks in the social services don't get paid a lot of money. And so Journey is working on that piece. I know that they've increased salaries and benefits a little bit over time. But yeah, I'm concerned about retention. And it's really more on the crisis worker side of things, just because of the nature of how much they're paid. And honestly, it's been a rough couple of years. Crisis workers are overtaxed more now than they have been ever in the past. And so that's another layer to all of this. And so, yeah, I'm concerned, and I don't think I have all the answers about how we're going to retain folks, especially as we keep growing, other than to keep working with Journey Mental Health. And Dane County Human Services holds the contract, and maybe they can offer some thoughts on how we can increase the retention as well.
Thanks. I appreciate the answers.
So I have 3 alders in the queue and 2 minutes before our assigned stop time. So if you can keep your questions and your answers short, that would be great. Alder Wahili.
Thank you, Madam Mayor. Thank you for the update. My question is, between September 21st and June 22nd, you had 600 calls. Was this number expected? Was less than expected? And my second question is, what has been your outreach strategy, especially to the marginalized community? As I saw the demographic, there were less percentage for people of color who have been who have used the program.
Yeah, and so to speak to the demographics, if you look at the population in the city of Madison and what the breakdowns are, what I mentioned is that our numbers seem relatively consistent with the breakdown of the populations in the city of Madison. But we have been doing quite a bit of outreach. We have a person hired at Public Health that's helping us with outreach, and I've spoken to quite a few of the alders in here with groups that they've wanted me to come to, but we're always open to suggestions about outreach. The call volume question, we didn't really know exactly what to expect. We knew that the police department went on like 7,000 mental health calls over a previous year, but that's 24 hours a day, 7 days a week, and so we initially expected to be a little bit busier, and so that's why we started in that central district, and then we expanded pretty quickly because we had the capacity to go on more calls. So at this point, going on 678 calls in not quite a year, I think I would have expected a little bit more, but we also didn't know what we didn't know, and we were a little cautious to start and safe. But now we're trying to catch up, and we're still looking at a lot of data. We need a lot more numbers to really tell us if what we're doing is the right way to do things.
Thank you.
Thank you. Alder Verveer?
Thank you, Mayor, and thank you, Chief, for your efforts and for your presentation this evening. I have two questions. I'll try to be quick about them.
Me too.
The first is, obviously, CARES 1 has been operating 11A to 7P. I understand the announcement this morning spoke to expanded hours. Could you share what those expanded hours are?
Great question, because we didn't mention that. So when we have two teams working full-time 5 days a week, we're going to have one team start at 8 a.m., and then the other team is going to start later in the day so that they can serve until 8 p.m. So we'll have 12 hours of coverage Monday through Friday. So they'll be working those 8-hour days, but they're going to overlap in the middle. And the middle of the day is actually when we have the highest call volume. So we'll have two teams in service at the same time for 4 hours in the middle of the day. And the next expansion, and this is a little bit down the road, and I'll be quick. The next expansion that we are going to ask for is to start working some weekend hours, at least 8 hours on Saturday, 8 hours on Sunday, hopefully in the 23 budget.
You anticipated my follow-up, and so that was, does the CAD system or other data or anecdotal perhaps even share with you all what you think the next need is? Is it the weekend midday? Is it
Yes, the
evening?
The next need is weekends during the day. Believe it or not, evening hours are not an incredibly busy time. I would have told you otherwise. As a paramedic working in this city for years, I would have said that weekends and evenings were the busiest, but that's not what the data showed.
And then if I could squeeze one more quick one in, I couldn't help but notice the different vehicles between what you have at Station 3 on Willie and the temporary Station 6 at Fish Hatch. Is that purposeful, or is that just temporary that you've changed the look of the vehicles?
It's purposeful. We're going to be using fire department SUVs. In order to get from Willie Street to the far west side of Madison, we can't have a minivan with no lights and sirens. It was taking us way too long to get around the city.
I see.
We need an emergency vehicle. I know that wasn't the most desired vehicle for us to use, but we need to.
Are you saying that the protocols are now that CARES 1 and CARES 2 do respond hot to most calls, or?
Not most, but they will if needed.
I see.
And that's just unfortunately the nature of the 911 business, is that they need to get places more quickly than they can get right now.
Very good. Thank you very much.
Thank you, Alder. Alder Miadze, last question.
Thank you, Mayor, and thank you for the presentation. I really appreciate it. Yeah, just two quick questions. Just wanted to see if alders can still come and check out, and, dispatch and see what calls and go to CARES and.
Certainly.
Okay, and a second quick question was also, do you keep the data on how many calls MPD goes out to and say, well, you know what, this is a CARES issue, or vice versa?
So yes, but it's hard to track. So we know when MPD is going in instead of CARES because CARES isn't available. But when CARES isn't in service, we have a hard time getting the police department data to show us exactly how many calls would have been appropriate for CARES because they're handled in a different way. If that was kind of your question.
Oh yes, thank you.
We're still working on that piece. There's data coming in from a lot of different organizations, and we struggle with it sometimes.
Oh, thank you.
All right. Thank you much, all of you, and thank you, Chief, for giving us the presentation. Certainly, Alders, you're welcome to follow up directly with Chief Stedman if you have additional questions in the future and want a more specific dive into the data. Thanks again, Chief. We're about 7 minutes out from the council meeting, so we'll adjourn our presentation until then.